Heart specialists at SSM Health St. Louis University Hospital have a new option that avoids open cardiac surgery for some patients. Called Transcatheter Aortic Valve Replacement, or TAVR. It's for high-risk patients suffering from aortic stenosis.
Aortic stenosis is a narrowing of the door between the main pumping chamber of the heart and the rest of the body. So no blood can get to the rest of the body without going through that door. And the stenosis part means that that door doesn't open all the way. And so the blood flow out of your heart is restricted. Obviously, that could potentially cause significant problems.
Traditionally, the surgical option is a procedure where a surgeon opens the chest with a sternotomy, leading to a lengthy hospital stay. With TAVR, SLUCare specialists partner on this less invasive option.
We can replace those aortic valves by putting a catheter up from the leg, across where that valve is, and allow a valve to be put where the old valve was, pushing the old valve out of the way and allowing the new valve to be functioning instantaneously. You don't have to have an open incision through your chest. That means that your recovery time is less and the risk overall for the procedure is less.
TAVR is currently approved by the FDA only for patients at high risk.
Only a certain group of patients who need aortic valve replacement qualify for this procedure right now in the United States. And those are the patients that are at high risk for an operation or are inoperable, or meaning that a surgeon says they can't operate on them.
Like all medical procedures, TAVR does come with some risk. For more information about TAVR at St. Louis University Hospital, visit SLUHeart.com.